Yeah, ladies and gentlemen, I'm very happy to be here today, and I'm going to talk about the digital transformation in medicine. And when you hear medicine, healthcare, I think most of you have a certain picture in mind. Most of you have had any experiences in hospitals, in a GP's office. Maybe those were good experiences, maybe those were bad experiences. You have a certain picture in mind of what a doctor is, what a patient is, and I'm here to tell you, you can kiss all of that goodbye. Because in the next, let's say, 5 to 10 years, we will see a transformation that will disrupt medicine and transform it into something that will differ a lot from what we call medicine today. And I spent the better part of last year trying to figure this out and condense this into a book which will be published in April this year. And to give you a better understanding of what I mean with disruption is to have a look at what I call impact areas. So disruption is a weasel word. You will find this very often when technical innovations are about. But what exactly will be transformed in medicine? What kind of disruption will we witness here? First of all, what we do in medicine and what doctors do, what nurses do, what therapists do, and so on, will be transformed completely. Digital technologies, data-based technologies, meaning big data analytics, meaning machine learning applications, are not just better, more sophisticated tools. We are not dealing with a better stethoscope here or something like that. We are dealing with a new way of encountering patients. So the fact that we have totally new means of collecting data, of analyzing data, of operationalizing data, means that doctors will read their patient in a totally different manner. So doctors will increasingly encounter data models of the patients, and on the other hand, patients will increasingly contribute to this model by collecting health data themselves through mHealth technologies, through smart wearables, and through Internet of Things applications in their own homes. So what we do in medicine and how we encounter each other will completely change. The second impact area is the environment we do healthcare in. And this means both the professional environments or the working environments, because a lot of these technologies are used and will be used in order to optimize workflows. But also the daily lives and the homes, the private realms, so to speak, of patients will be transformed. A lot of these technologies are focused on prediction and prevention. And in order to do this, you need behavioral data, you need environmental data, data a patient produces in his or her daily life. Usually, medical data consists of lab results, something like drawing a blood sample and analyzing it, but this only gives you a snapshot of a patient's health situation. With smart wearables, with Internet of Things that are present in the daily lives, in the private realm of a patient, you have the chance to get data that is produced on a daily basis in totally normal situations and not in the lab situations that we find in hospitals or in the GP's office. But the presence of these technologies in the daily lives, in the home environments of people, means that these environments will be transformed, they will be technicized, and they will be medicalized. Medicine, their own health, becomes a topic that is always present in the patient's life, or even in the daily life of a healthy person. And the third impact area is relationships. The most important relationship in medicine is the therapeutic relationship between doctors and patients. And this relationship will be rearranged, firstly, by these mHealth applications and Internet of Things applications that rely heavily on self-management and self-monitoring. So patients become a totally different, or they will have a totally different role. They are not passive recipients of doctors' orders anymore. They will play an integral role in the whole healthcare system, and an active role by collecting data themselves, by taking control over their own health, basically. What is the goal of all this? The main goal has been called 4P medicine. And these 4 Ps stand for prediction, personalization, prevention, and participation. So the focus in this new medicine is more on the future, right? It's on future events. It's preventing risks, preventing disease from happening. So it's not about repairing illnesses and disease so much. It's more about preventing their onset by combining multivariate data from all areas of life, by using a considerable amount of monitoring and surveillance technologies. And these technologies can be used to empower the patient, include the patient as an active role in this whole process, but at the same time harnessing a patient-centered medicine that is more focused around the individual patient. Up to now, if you as a doctor have a patient with a cardiovascular disease, for example, what you would do is you would look at the best available evidence, at the papers that are out there, and these papers rest on studies that were done with thousands of patients. And what you get from these papers is an average patient. So with the average patient, this and that medication works this and that way. And then you have to figure out what does this mean for the individual patient at hand that I'm dealing with now. And the new way of processing data, of collecting data, of making sense of patients focuses on the individual patient, on the individual data from this very person. So it's a much more patient-centered medicine, and you're not dealing with average patients anymore. And the crucial enablers here is AI technologies and big data technologies. They will give us the means to do this, to process this individual health data. This is all very abstract. And to give you an example of something that is not clinical standard right now, but will be in, let's say, 3 to 5 years, I want to talk about digital twins. Maybe you've heard of digital twins from the engineering sector. Digital twins is about modeling a product throughout the whole production process and then making decisions based on this model. In medicine, something very similar is happening where you can have a digital twin based on data models of, let's say, an organ like the heart, of a structure, for example, the cardiovascular system, or even of the whole person. You can model the whole organism based on the data that is taken from the electronic health records, from lab results, but mostly from behavioral data and environmental data that is collected by mHealth technologies and Internet of Things applications. And this gives you really the opportunity to combine genetics, anatomy, physiology, pathophysiology, environment and behavior into one coherent model with which you can work. For example, as you see here in this graphic, you want to find out what is the best medication for my patient, and you could, of course, try a certain drug until you figure out what is the right dose and so on the patient themselves. But the much better way is to simulate it. You have this data model, you simulate what happens when I feed this data model with this and that drug, and then it tells you what is the right drug for your patient, and then you administer the drug to the patient. So the idea is that this model, this digital twin, is bidirectional and dynamic. It's dynamic because it's not just a snapshot, but the data is continually updated. So it gives you a longitudinal model of this organism. And it's bidirectional because you make a therapeutic intervention, you give this drug to your patient, which generates new data, and this data flows back into this model, which tells you, well, was my intervention successful or not? So you have a very actual model, a longitudinal model of your patients. And the goal is to predict and to prevent risks and personalization. So you can not only use this in case of a patient that suffers from a specific disease, you can also use that to monitor and survey the health of a healthy person and predict health risks and outcomes that you want to prevent. So predictive data analysis of disease progression, for example, as I said, drug testing, but simply lifestyle monitoring. So this is not for healthy, this is not for people with a disease, but it's also for healthy people. And it enables a personalized treatment based on individual health data. And if you think about these technologies, what they do is they also change the ways we think about health and illness. We think about what does it mean being a patient. And they totally transform the roles that we have in this whole encounter. And this is why I call this liquid medicine. Because what we're witnessing here is a liquefaction process. Something becomes liquid, becomes malleable, that has hitherto been very solid. Right? Health and disease were very solid categories. Doctors and patients were very solid categories. The medical realm, hospitals, GP offices, and the private realm were very solid categories. But all these categories, they become fluent. They become fluid, and this is why I call this liquid health. The first thing that is liquefied is our concept of health and illness. So what we are dealing with now is what has been called the risk-centered medicine. So a medicine that looks into the future, that tries to identify risks and prevent risks. And this is a good thing, of course, because it helps you to plan ahead. But at the same time, it creates what has been called individuals on alert, which means that you are so aware of your health, you are so aware of your risks, that health becomes somehow fluid. You are never really healthy, you are simply not ill yet, right? So this means health is usually something that you feel only when it's absent, right? You start to think about health when you're ill, because then you see how important this is. So this works both ways. It can raise awareness for something that is very special and very important, but at the same time, health is always in flux. It's no stable condition anymore. It's a permanent risk there, and you are in constant danger of becoming ill. And this takes much more room in your life then. Care and surveillance is therefore necessary. So some people speak of a flexible body that requires constant surveillance. And this has to do with this predictive focus where risk prevention is really the important thing. Another thing, or another area that becomes liquefied is the borders of the medical domain. As I said, it's unclear where the competence of medicine even ends. You are supposed to do all this self-monitoring and self-management. You have so much individual responsibility, which some have considered a privatization of health, entrepreneurship of health, but at the same time, this desolidarization is accompanied by the expansion of the medical domain that invades into your private realm, right? So we have these processes both at the same time. And finally, what is liquefied are the roles in medicine. This participatory focus on self-management and self-monitoring is sometimes understood as empowerment and democratization. So patients have a new role. They are not passive recipients of doctors' orders, but they play an active role in this whole encounter. At the same time, given that all these data-intensive technologies rest on this business model of surveillance capitalism, this means economic agents are now part of this therapeutic relationship that totally changed the power relations, either for the better or for the worse. But the impact is that doctors kind of lose their gatekeeper role here, because there's a new sheriff in town, so to speak. There's a new agent within this therapeutic relationship, and we don't have any model that is capable of making sense of this new power dynamic we're dealing with here. So health and surveillance go together, but they have also a downside, which is ubiquitous and permanent surveillance with this risk of disciplining instead of empowerment, meaning that you can sell these individual advantages of all these health monitoring also as something that is not only mitigating risks, but engendering health agendas. For example, you want to reduce costs, you want to reduce health costs, you want to reduce human labor. and so you promote all these mHealth applications, for example. And this is not necessarily for the benefit of patients or other stakeholders. So what are the strategies to cope with this? That health becomes liquid as such is with every disruption not necessarily a bad thing. Something good can come out of this, because liquids have the big advantage. They are not solid anymore; they are malleable. So we can reshape them, and the same. It's the same with health and illness here. So what we can do is we can focus more on new ideas, what data is, and what our social practices are that deal with data. So critical data studies might help us here in medical training, for example, in medical education, but also in a business context to better understand what data is, what it can and can't do, and what we can get out of it. Another strategy is participatory technology design, where we include the target groups that these technologies are meant for in the design process. And this is very important, because only then we can make sure that we really have this personalization that we want inscribed in the product from the beginning on. Well-being and empowerment, which is always a big selling point for these technologies, is all very well, but it doesn't happen automatically. We have to define this from an early design stage on as a main goal of these technologies in order to really make it happen. And one way to ensure this is have a human-in-the-loop approach from technology design to technology use, to make sure that this is a goal that is not something like an add-on, but a crucial goal of all these technologies. And then we can really make something of this new liquid health. We can take this new understanding and this disruption and turn a risk into an opportunity. Thank you.